Well, good afternoon, and thank you again for joining this webinar from Space Door Healthcare this afternoon. I'm Shane Barry and a concept advisor at Space Door Healthcare, and we'll be chairing this webinar this afternoon. So very excited to join the conversation. Just before we start, for those that are joining either via Teams or via LinkedIn Live, please do pop comments in as we go along, and we can field them to the panelists and answer them as we go along. Be glad to hear any thoughts and comments from the audience, either via LinkedIn or the Teams chat. So, as a quick background before we jump into today's topic, just wanted to cover off a bit of background to Space Door Healthcare. So, Space Door, as a background, are creators of architectural space-defining furniture. It's a blend of California cool and London design. And we've learned from a long-term engagement with some of the world's most successful global companies, so the likes of Google, Pfizer, Reg Diagnostics, on how do we create a sustainable workplace, whether that is for them currently attracting employees back to the office, adapting their space to a hybrid way of working. And whilst we're experts in manufacturing furniture, what really sets us apart is our mass customization process that allows us to tailor these cornerstone solutions for the clients we work with. And one of the products we co-created back actually before COVID was the world's first video pod designed from the ground up. So that was a pod we designed for video as opposed to phone calls. And over COVID, the increase in virtual consultations within the NHS was a big driver. And they were actually coming to us saying the product you've designed for your clients is really relevant to us and the needs we've got. So that's where Space Door Healthcare has come from. And we've been working with NHS trusts mainly on helping them with the outpatient transformation. How do we increase virtual consultancy and address some of those challenges involved with that? And also what solutions can we present? So today we just wanted to share some insights around that, and with the panelists we got on board, we picked a topic that tries to address some of these challenges. So people versus digital. So we've obviously got the human preference, how we like to do things, and also then obviously digital, which can really help us transform healthcare, but also how the people are a massive part of that, whether that is the staff or clinicians themselves, or whether we're actually looking at patient and what the patient preference is. So that is the topic for today. Before we dive into that, just wanted to quickly introduce everyone. So as I've said, I'm Shane and a concept advisor at Space Door Healthcare. So my role is working with the likes of NHS trusts or architects and designers working on healthcare projects and helping them how I can give expertise on some of the products we use and have developed with other clients to help them transform their workspace, but also ways of working, and then along that change management, adapting to new ways of working. So maybe Ben, over to you if you want to introduce yourself, please.
Certainly. Hi. Yeah, my name's Ben. I'm an Associate Chief Clinical Information Officer working at Midlands Partnership Trust in the Midlands, so largely Staffordshire based. But I'm a clinician by background, so I work in an MSK clinic still 1 day a week, so still very much involved at the front line in clinical practice, but actually sit within the digital teams working on and driving forwards transformation and innovation at the same time.
Excellent, very good, and thanks very much for joining us today. Pleasure. Bucky, over to you.
Hi, good afternoon. My name is Buki Mokariola, and I'm an Enrich Manager at NCL ICB London. But before this current role, I was a project manager within the outpatient transformation team, looking into the various transformation programs just after COVID. And I'm also a nurse by background. I'm a clinician by background, so I could relate with people versus digital that you're talking about, because obviously the passion comes from being clinician and wanting the best outcome for the patient.
Very good. Thank you very much, Bucky, and also glad to have you on the call as well. So again, as we go through, just encourage any of the participants joining us just to ping any questions in the chat as we go through, and we'll try and answer them as we go along. Good. So to kick off, just going back to the topic of people versus digital and how do we transform healthcare for the better. What I was really thinking was around this topic is the fact that you've got the dynamic intersection of human-centered care and digital innovation. How do we join that up together? guess, around enhanced efficiencies, improving the patient outcome. That's obviously the main goal, greater accessibility for anyone and everyone. But also, I guess some of the challenges we've come across with a lot of trusts is the daily grind, and how that brings challenges and frustrations with new technologies. Um, so how do we bring this all together and help transform healthcare quickly, for the better with all of us? So maybe Ben, have you got some initial thoughts around the topic?
Yeah, I think for us, going through COVID, we've seen an exponential increase in digital and tech, haven't we, recently? So as torrid as a time as what that was, there's definitely the benefits that we need to capture and keep taking forwards. It's something that is a real challenge. Healthcare is stretched, it's pressured on numerous fronts, both demand capacity, but financial constraints as well. So the question comes down to, well, how do we keep driving that forwards and really accelerate that change of transformation within that background as well? And then very much the context of people at that as well. Ultimately, that's the biggest area that we need to make sure we keep focusing on in terms of ensuring that transformation is successful and is sustained as well. I think we've seen that in COVID. We've seen how quickly things can accelerate, and it's much like health gains. If you gain some fitness very, very quickly, you're also more likely to lose it quickly. So if we apply that same sort of principle to our gains in COVID, we can probably start to see why, with it being an enforced change, an enforced rollout, and a rapid rollout at that, it's perhaps not surprising why we might see some regression. Some areas may well be sustaining it and building on it very, very well. But then I think there's also areas where that is naturally going to regress. Not that that's right, but certainly would need some evaluations to try and sustain it moving forwards, really.
Yeah, that's very good. Thanks, Ben. And I think that ties in with one of the points we discussed before about what was achieved in COVID and how do we actually sustain that and not return to the old ways, which is obviously a big challenge for everyone. And I think we've even seen it in some of the clients we work with, not just in healthcare, but across sectors, is a big challenge that COVID was a big disruptor to every way of working. And how do we make sure that the beneficial changes that we did make in COVID are actually rolled out and continued, ongoing? Bucky, you'd have some thoughts.
Yeah, I'm gonna start from where the enforced change that Ben actually mentioned. And that's what, at the time that during COVID we don't have an option, so we just have to adopt it. But what we didn't do then is also transformation of human thinking of our workforce to actually embrace in terms of training and development for them to be able to adopt this, I mean, and sustain it, for us to sustain it. And hence why we see things dropping. Because fine, I mean, the mindset was, oh, we use it for that period. When in lockdown, we have got no option. Now there's no lockdown, we can go back to our old ways. But what we failed to do just towards the end of the COVID is to actually develop the workforce, people as people, not just workforce, but even our patients in terms of how do you find this? What feedback did we take? How did we actually uh, convey the message of the importance and the benefits of what we did during COVID? I mean, I just believe that everything is just now um, being forgotten, and we're not taking the benefit, and we're actually not even also pub- uh, publicizing it, letting people know that this benefit could actually help us not just in transformation, but in efficiency and in savings, and also in improving the outcome as a whole. We've seen it in COVID, but because we didn't do that transformation and change in terms of letting people mindsets. What's our mindset? That's why we are here. We had today. So I think for me, people are behind digital. People are behind technology. But obviously, we need to look at our customers, the people that are going to be using it. How do we actually carry them along to be able to sustain what we actually introduce? I think for me, yeah.
Yeah, no, that's good and a kind of ongoing challenge. And from your experience, what's one thing you may say that has worked in helping, um, transform that workforce and embrace this kind of change? Have you any experiences you can share on that?
When I was a project manager, one of the project, my main project was about patient engagement and experience, and is about developing a co-production approach whereby patients and staff, everybody involved, are actually they supported the transformational program. So it's not just, oh, this is we're introducing people, we're introducing virtual space, a virtual consultation. Is about how do you feel getting some patients to actually input into that and into the development and the rolling out. And I think for me, that was really helpful because then we're not enforcing change. We're actually involving everybody that will be that are main stakeholders in the change. And that is for me, it's very important that when you're making change, involve all your stakeholders, understand the challenges they could face and how best to support them in overcoming the challenges. I think for me, there are things that I discovered then that I never knew in terms of, okay, finances may be a huge issue for this person. This person may not actually have the smartphone, and we're expecting them to have a virtual consultation. Those are the things that I picked up. And I think for me, when we are looking at change as a whole, it's the co-production approach is very crucial because then we will know where there could be possible pitfalls along the line.
It's good. Thanks, Ben. You probably got some more thoughts around that as well.
Definitely, and I love your background experience in project management, Bucky. And so your points around that engagement, that is absolutely key. It's that buy-in. So again, taking it back to COVID, it's that enforced change. There was that buy-in because we knew that we had to, and as you say, there's that degree of choice now, and we have regret. There's certainly, it's clear that there has been those areas of regression. So what we need to look at is that, well, how do we get that engagement again and go back to where we were, retrace some of that old ground, but then make it more sustainable? And your points around stakeholder engagement and involvement, I think when you look at some of projects and how they work, again, you might see that as an area that's lacking. And it's a challenge. It's a challenge to get that stakeholder engagement involvement when some of these projects are so wide. And you come in as a project manager, well, where are these people that I need to have involved directly within the project? Where are my change agents? Because again, we can go, oh, look, we've got this lovely project, we've got this wonderful bit of kit, this solution that we're going to deploy, and people think, well, we didn't ask for it. I don't necessarily know that we need it. So how do we get that sale? How do we get that buy-in? And like anything, there's usually multiple different facets to that. And you could just be simply approaching it at just not quite the right time. A service might be under a peak of demand, but actually your project timeline says, well, now is when we're doing it. And you might just meet at the wrong point in time. And again, that's where with our project approach, we need to go, okay, fine, pause deployment to you, but we're going to go to a different service and deploy here, because actually overall we'll get a better benefit rather than being like, that's the project plan, got to deploy here, that one's done, and they've got to move on to the next one. So it's that stakeholder engagement, involvement, but also using the intel that they give to adapt your project approach as well. And again, it's some of those things that are very difficult to do because everyone's stretched. Clinicians are stretched, project managers are stretched, project teams are stretched, and it's very difficult to bake that flex in sometimes. And then particularly on your point around kind of ultimately what we're here for. We're here for service users. And we might see that it's not quite the right time for a service, but actually for the service users, it's absolutely the right time. And if you've got that intel, that might then change the narrative and the buy-in and therefore the success as well. So it's all of the stuff we know around our project management theory, but sometimes naturally there's bits that aren't kind of used in practice quite so much. But like anything, if you go back to it, you can often see, well, actually that wasn't done quite so well. That might be one of the reasons as to why it didn't work quite as we intended it. And it's that follow-on as well. You mentioned benefits. And you could kick me off onto aspiring conversation around benefits management, but yeah, we might come to that.
No, that's good. And I think your point about learning from experiences. So appreciate that obviously if something is implemented in a rush, e.g. COVID, where we had to do something different, it may not have worked as well as it could have done. But it's then learning from those experiences, what worked and what didn't work, and then how can we implement it better ongoing, for everyone as a rollout. I was wondering if you could just comment on a few, like, what are some of the key obstacles faced when implementing with digital technologies, and any sort of strategies or anything you've used in your experience to overcome them?
Okay, do you want to go first?
Yeah, I think for me, the first thing is time and is managing expectations as well. Because as it is, our workforce is stretched. We are stretched. And now you're bringing, and for me, it's like changes after changes after changes after changes. And you look and thinking, when is this going to end? And I think for me, change is good. Don't get me wrong. I embrace change, and I think change is the direction of travel for everybody. However, it's also supporting people during the change. I think it's easy for us to bring things in, but we're not looking at the support required to ensure that people engage with the change or we get the buy-in of those people that are crucial to the change. For me, that is very important. And when I talk about key stakeholders, you really need to look for champions. You really need to look for those that could make that change happen. Who is the key person in this team? Who has the authority that will help me to ensure that this actually worked? And also understanding the dynamics. How can I maximize that? How can I utilize that to the advantage of this change? So, just like Ben said, sometimes we don't build flexibility. We've got our timelines. We need to make sure that we meet that timeline. We've got that target. However, there may be a need for us to pause and understand, how do you feel at when we're looking at our milestones? Do we take feedback at every step of the milestone? Not necessarily on everyone. It might just be a quick, where's my steering group? What do you feel? What do you think about it? And I mean, for me, for me, that is one importance of the steering group. For me, it was really helpful when I used them, and it helped me to actually navigate an unknown territory, because I mean, outpatient is just a new territory for me, but it really helped me. So I hope I've been able to just answer that.
Yeah, it's good. Go for it, Ben. You can expand on that.
I think you're absolutely right, Bucky. For me, it always comes back to people, doesn't it? It's always people, but not necessarily that the people are at fault, but it's the things that are wrapped around people and those on the receiving end change. And I think it's all the fundamental things that, again, going back to your point earlier, Bucky, around time. We're always limited for time, and that's the same within projects as well. We're so limited on our resource in the NHS and other industries. So the focus is on kind of getting that complete and getting over the line. What that doesn't naturally lend itself to is having the capacity within that project to do all of the elements that otherwise contribute to a successful project, therefore deployment and therefore sustainability of that product at the end of it. And I think for me, a lot of that comes down to the benefits work, benefits realization. So, what is your baseline measures? How is that feeding into your case for change? And again, that's that people go, oh, that kind of makes sense. And we're getting that buy in rather than going, oh, this is being deployed. Again, taking it back to COVID, we know why we had to shift to remote consultations and that way of working. That was all bought into. But the case for change changed when those elements, kind of were reduced. But what there wasn't was that case for sustained change. I think that's coming back in again around things like productivity. We're hearing that around a lot of the agendas that are coming out, limited resources, how do we do more with less, and so on. So we might start to see this kind of dip that we've had from remote consultations that way working starting to pick back up again. But I think for me, that's going to be a harder journey than if we were doing this from the ground upwards if COVID hadn't have happened, because again, had to be deployed quickly, perhaps wasn't as good as what we would otherwise have expected to. I think we can see in the NHS, which is absolutely great, clinicians have got very high expectations of the thing that we're deploying, and that's absolutely where we should be. But if there's a mismatch in that, we're going to see some challenges in sustaining that. So I think those experiences that we had in COVID weren't quite perfect. Not that necessarily perfect is the way that everything should be. Don't let perfect be the enemy of the good. But because of those experiences, that's probably going to give us some reluctance to then going back again. So I think we're going to have to work doubly hard on that case for change, the benefits, what's the initial point we're going to, and where we're going to, and why, and what for. sustainability agendas and fitting that back in. Again, remote consultations is certainly one of those key things that's going to allow us to hit those 2040 targets. But without that buy-in and that compelling case for change, I think we've got those challenges. So it's very much people, but the infrastructure and how we approach it in the background that really, I think, is going to be the barrier to success. We need to do that foundational work and do it really well as well.
Yeah, very good, and yeah, that's important. As you say, to make sure getting it right first time is helpful, but then as you kind of learn from those what doesn't work as well. So it's kind of
Absolutely.
making sure we fix what goes wrong. I was wondering in terms of focusing on kind of you've got staff preferences and then patient preferences, and I guess for some of the work we've done, we've seen where sometimes the patient preference isn't always worked on. So if the clinician has or the team has a certain way of doing something, often if or the other way around in terms of it may be standard to have a phone call first, whereas the person wants to be seen. What's some sort of advice on managing the expectations of both parties on that?
Okay, any immediate thoughts on that?
For me, that has been, you mentioned something about mismatch, and I think that's one of the pitfalls of some of the things that we gain. Because seen the experience, we are like, okay, the processes are not really perfect at that time. And the moment we had our opportunity, so we're not like things that were not really aligned to work really well. So for me, it's understanding the patient, and that's why co-production is important. That's why engagement is important. What's wrong with the patient preference? What's the patient preference? Why do they prefer that? Those are the important things that we need to pick up. And is there any options? And how have we been able to explain all the options that we have? So if we're looking at remote consultation, why would our individual prefer to come on site rather than having a remote consultation? We need to consider the demographics we are serving as well. Because if it's an older population, it might be that is the only opportunity to come out of my house. Then that's understandably. How can we facilitate that? For younger generation, that's a quick win for me. I'd rather stay in my house. You can do, and also for the one of the things that I discovered then is the fact that we're talking about technology. How many other generation have got the fancy phones? They just is people in their 90s in there. So we need to consider all these preferences and why the patient will choose to go for what we're not offering. And it's better for us to actually adapt our services in such a way that could meet the needs, or otherwise we could, just back to what Ben said at the other time. I'm not sure. Just referring back to what will be your preference? This is what we've got. And in the cohort of our patients, what are they used to? How can we change? I think for me, it's understanding what is required to change, what is the best way to make the change, and how do we best communicate this? And how do we understand the impact of the change on our consumers? That's very crucial. And for me, it's important that we get that right for us to sustain any changes.
I agree. I think it's absolutely about patient preference, and baking that in and being able to adapt to that. So, take very simplistic things to compare to. Do I come in for an appointment or do I have a remote consultation? And some patients absolutely will have a preference. And there's a number of reasons as to why they'll have that preference. Travel, cost, parking, loss of earnings if they're having to come out of a job to attend an appointment versus well, actually, do you know what? My employer can be just a little bit flexible for me to take a 20-minute call. So I would prefer a 20-minute call. But actually, if the service is set up saying, look, really sorry, but actually this is a face-to-face appointment and the clinic is here, that's your option. We're really not meeting the needs of our population and all the secondary economical things that come with that as well. Again, taking it back to sustainability. Well, we're not meeting our sustainability agenda because we're basically invoking that patients travel to all their appointments rather than being able to have a remote consultation. And it comes down to choice and an informed choice. I think clinically we're often we're very good at making those shared decisions in clinic and managing those risks. And well, look, treatment A versus treatment B, these are the outcomes, this is the differences. One's got slightly more risk than the other one. And they get a patient, well, actually, I hear you tell me that treatment B's got more of a risk to it, but you know what? I think that fits my needs better. So I want option B, even though option A might be slightly less risky. And it's the same for attending appointments as well. It might be less risky to attend a face-to-face because as a clinician would approach it in a certain way and be able to do this test and that test. So there might be some things that can't quite be done with a remote consultation, but weighing that up so there's an overall weighted decision by the patient and service user, they might say, do you know what? Video consultation, hear what you're saying. Slightly more risky than being seen because you can't do this and this, but you know what? Option B, video consultation works better for me. And again, comes the bits around, well, actually that as a conversation process might well need to be documented, but I think we need to be far more adaptable in what we're offering for patients. And again, clinicians as well, a lot of clinicians are now back to work 5 days a week, and we've lost that element of flexibility for these remote consultations. And do you know what? Your Tuesdays, it's your remote consultation day. It means you don't have to travel in. Staff car park, it's not overwhelmed, and so those that are coming in can get in. There was a period of time where people weren't saying, I can't get a parking space, and we're back to everything again. I can't park, it's stressful. I have to come to my appointment an hour and a half early, otherwise I know I'm not going to get a parking spot and I'm then going to miss my appointment. So again, we need to be looking at all the secondary and further consequences beyond the things that we're setting up really. But absolutely, patient choice at the forefront, taking a user-centered design, and that isn't just around tech and solutions, that's around how our processes are set up as well and our pathways to meet the needs of our patients.
Yeah, very good. And I think we've even seen that across, again, as I mentioned before, the different sectors we work in, and there isn't a one size that fits all. There is different ways that people like to work and different settings they like to work in. So in terms of an office space, some people like working from desk, others don't. And it's kind of making sure we are catering to everyone's needs and different ways of working. Just had a comment in the chat about obviously not focusing just on the patient preference, but the staff preference and the staff's ability. If you have any comments around that.
Ben alluded to that in terms of staff preferences, and to be honest, I think even choices are getting. I mean, we're not no longer available. It's that your contract says 5 days a week, you must come to work 5 days a week, and I mean, obviously, that even when people are willing to like, okay, I want to be flexible, can I not do this? Because to be honest, I am the expert in what I'm doing, and I can tell you, looking at my workload today, I can possibly do about 5 patients or 10 patients remotely, rather than having to not just me traveling, but them traveling. And you mentioned about the zero nets. That I mean, all those things. I think for me, it also goes back to education, not just the front line, everybody, operational team, the senior management, the middle managers, the frontline staff, to like have a greater understanding and awareness of my action. How does it translate? What's the long-term impact? What's the short-term impact of the decision that I'm making now, even based on myself? So I've seen, and I know there are clinicians and operational teams that have said, can I work from home tomorrow? Oh no, I mean, we just go back to the default 5 days a week. And that's why it's important to say, okay, fine, if not, that's no problem. What would you be doing? How could we do things differently? And we come into days where we need to work innovatively. We need to work smartly. We can't be doing things the way we were doing it and expect a different result. I mean, we're working on finite resources. We need to look at how we can maximize our little resources and what we can do differently. I mean, where I work, you could possibly work remotely and be able to cover more than having to come to the office and do less. And how does that translate in terms of efficiency, in terms of productivity, in terms of what we contributing to the even to the overall NHS agenda? I think for me, it's something that, I mean, whoever puts that into chat, that's really good. It's something that all managers need to revisit, and we need to also put it on the agenda for our managers as well.
Quite agree. It's definitely all about the staff as well, because again, ultimately, no patients get seen without them. And it's costly not retaining staff, is it? So whilst me, absolutely priorities is that of patients. Well, that goes hand in hand with staff as well, whether that be frontline or not frontline. The backroom staff in the NHS support the direct front lines, and then they all work together. So if we can get the best out of everybody without burning them out, but they feel enriched, they feel valued, then as you say, we'll get more out of them. If people are being dragged into a working place physically 5 days a week, but that doesn't align to their work life requirements, then we're going to end up some problems pretty quickly, really. I haven't got the reference, but a colleague was talking this morning about research in terms of different companies where people have basically been instructed to come back to the office full time, around their productivity and how likely they are to stay in their position or not. And again, we go back to pre-COVID, that look at our productivity before. We didn't have all the video meetings we had. We were traveling around. The inefficiencies that were in the system then, again, that's gone. But what we're finding now is we've got back-to-back meetings all the way through the day. So actually, do you know what? Doing slightly less is probably going to mean we're a bit more productive. And having that flexibility to be able to do those things, and what we need is to be able to still do that for clinicians as well and frontline staff. If it means that you are better finishing at 2 o'clock on a Tuesday, so you can go and do something that's for your own benefit, but your other hours are put on elsewhere, that's fine. But also having that flexibility around, well, Tuesday this week doesn't work for me, it needs to be Thursday. How do I change that? How do I adapt that and get the best out of our staff? So people go, do you know what? Good place to work. I get, that this works for me, and that works both ways. Somebody might have a home setting that means, you know what, I prefer to go to the office because it works for me, and it's only around the corner. But you know what, I can be more productive because I haven't got two screaming kids that keep interrupting me every 5 minutes, or whatever that might be. So again, there's got to be that ability to flex and change that, and it's different from one person to the next. I think there's discussions around, well, that might look favourable to one person to another, but I don't know if consistently those conversations are being had at an individual staff level to go, what works for you versus what works for you, and therefore the setup is going to be different. But also that's revisited as well, because again, things change, don't they? Circumstances change. So how do we keep that as well? But I'm aware, again, going back from my clinical experience, it's really difficult to do from a frontline clinician point of view, because your clinic is this and it's this time and it's booked, and they're booked weeks in advance. So to be able to change that then, and then we are inconveniencing our patients if we need that. So difficult one to do, but essential nonetheless.
Yeah, no, it's good, and change is the only constant, so you have to keep revisiting it to make sure we're keeping up to date. A quick point on that, as often a challenge that comes up for us is obviously with, I guess, part of the whole change management, but if staff are feeling overwhelmed already with their workload and what they've got to do, and then you try to implement something new, anything you've found on that in terms of how you help staff along that journey, and maybe start with little steps and help them along and then kind of implement it. Any thoughts you had on that?
Just to jump in on that, again, it's around the timing as well. So if there is flexibility to do that, then that might be an option. Equally, it might not be. And again, repeating point, but it's around that engagement, it's around that buy-in. It's about people being heard rather than it being, yeah, I know you say you're busy, but you know what? This change is coming anyway. We're going live on Monday. It's around, is there a compromise to be reached there, or is there other support and infrastructure that can be put in place to help that? We know all change comes with a burden, and you mentioned around expectations earlier, Bucky. Often people have a really high peak of expectations as to what a thing is going to do for them, but there's always a learning curve. Even if you've had your training on your new EPR or your new bit of kit or your new process, it still takes time. It's still burdensome at the point that you're switching over. And not just for a matter of hours or days or weeks. It takes a long time for that to become the established norm. And again, I don't necessarily think we're good enough at putting in enough support to enable that to happen. Couple of kind of system transfers I've been involved in, both in terms of leading, but also on the receiving end as well. Clinics were reduced to give that element of it's going to take you longer to learn. So, yeah, I know you normally see 10 patients, but you know what? That's going to be 7. and will introduce a bit of catch-up time and take that burden away. So what can you put in place to reduce that burden so the end product is still delivered, we still get that success, we still get the transformation, but it's as easy as possible for front end and end users. But change always comes with a cost. But how do we manage that? And let's be clear with it. People need to be listened, they need to be heard, and adaptations put in place.
I think in addition to that, the health and well-being of your staff is quite crucial as well. And you mentioned that when you're talking about, flexibility and management. And when we're managing change, it's important that we also allow let our staff know that there is facility for you to come if you feel it's too much for you. I think we just need to create a space where where people are able to come and actually voice their concerns or their worries or the impact of the change on them. I don't think that's often available where people can come and let you know that this is the impact. And what I've seen also with changes is when it's being rolled out, we have the technical team that you can go to, and all of a sudden the technical team get taken away, or the technical help get taken away 3 months, 6 months down the line, then things happen and people were looking, they just feel that they're left to their own device. And I think it's quite important that uh no matter how small, that technical support should be long term for us to actually sustain the change and also to ensure that our staff have the space to be able to come and voice their, I mean, what's concerning them and how the impact of the change, not just on their work, but also on their health and well-being as well.
Yeah, thank you. That's very helpful. A question around looking at success of digital transformation. I was wondering how, or if you have used or have some thoughts on how do you measure the success and any metrics you've used or anything around that.
Ben, do you want to go first?
Yeah, I'm itching, to be honest. So for me, it's around the benefits realization work, and I don't see that done robustly enough consistently. So again, what's your baseline measures? So you might have your case for change, but what's your current state of play? So, how many patients are coming through? How long are they waiting? What's your waiting list? What's the metrics that your bit of thing is designed to change? Really hard to do retrospectively. There might be some data sets that you can go back to, but what is your baseline and what's your projected changes? So we might see in terms of benefits work either massively overestimating the change, that peak of expectation, when actually we know it's usually to be less than that, or are you underestimating the change? And that can be costly as well, not understanding that. And mapping that across, and that's part of the good governance in terms of project structure and approach to a project. What are your expected disbenefits as well, or what disbenefits could happen? Because sometimes we think that's going to be a great change. That's going to be a great change. We're really going to improve access. You might improve access, but does that mean that you're actually going to get an increase in the number of patients needing or coming through your service that you didn't otherwise get? So you might improve the access and reduce burden on your triage, for example, but you make absolutely zero difference to your clinical capacity. But that might have been the thing that you were hoping to change. So again, really taking some time to do some brainstorming and mapping around that, because when that's done well, there's less risk in terms of things cropping up that you weren't going to expect. And things always happen. We can't foresee everything, can we? But again, baking in tolerance. So what tolerance is within your project structure to be able to mop up those unexpected things when they do. You can't plan completely for the unexpected, but what is your plan for the unexpected? How can you have a bit of something ready to go? Otherwise, if your elastic is already at full capacity, then that's when we know that other things don't go quite so well. So I think for me, the recipes for success are absolutely around the governance in terms of it might previously be seen as red tape, but it can absolutely also be used for its benefit and ensuring success and doing all the elements of good project management.
I think for me, the governance is very crucial. And in terms of the KPIs that was set as well, sometimes when that is set in terms, it's understanding where the leverage are within that KPIs. So, okay, if we, for any reason, we don't, are not able to achieve this, how do we leverage what we've got? So it's quite, and the governance is the only thing that could help us to just look at this and understand where things are going wrong and how we could quickly, look into things. Now, you're right, Ben. In terms of the risk analysis, you can only estimate that this could possibly happen, but at the end of the day, there are some risks that were never thought of that will come, and you're like, okay, how do we deal with this? But for me, and that's where you need to build in some leverage in your KPIs to say, okay, just in case what happens, and yeah, that's what I'll say.
Very good, thank you. And just conscious of coming to the end of the time with a couple of minutes left, so I guess as we wrap up, maybe some final thoughts on the overall topic of people versus digital. Any key takeaways? I guess from my point of view, from our discussion, it's been quite clear. Obviously, we need to focus on people in terms of preferences, whether it's staff or patients, and making sure we are catering in terms of health and well-being. Also, making sure we are working on the change management from a digital perspective, because that is ultimately going to help us transform the healthcare. We can't do it without it. So yeah, that's a quick few takeaways from me. Ben, any key points to share to finish?
Sure, it's definitely always about people, whether that be service users, staff, whether that be frontline or support staff, project staff. So absolutely, it's always about people. So what's your framework that you're going to put in place? How do you work to ensure that we are keeping that focus? We are adaptable, keep your project tolerance, have a good project structure, live that structure as well, and reflect on when that's perhaps going out of tolerance or those structures and approaches aren't quite working so well, and bring it back and see how you can put them back in. But yeah, make governance your friend and use it for its benefit.
Very good, thank you. Lucky.
For me, let's not forget that digitalization is here to enhance whatsoever we've been doing. And if we keep that as our focus, we know that people actually plays a crucial position in terms of digitalization. And without people, we wouldn't be able to achieve our aim or anything we set out to do. So it's quite important when we're looking at digitalization versus people. Our stakeholders are very crucial. Who are my stakeholders? What is their preference? What do they want? And if I don't align my if I don't align my aim with what the needs of the individuals, then there's bound to be chaos at the end of the day. I possibly will not achieve it. So it's important to place people at the center, and then we can then understand how we can best support and enhance the needs of the individual at the center.
Excellent, thank you. Thanks again, Bucky and Ben, for sharing your insights on this call. Time has flown and we're just coming to the end, so we need to keep moving. So we also say a big thanks to our panelists for joining us, and thanks to our audience who joined us. There will be a recording available, so we'll share that out onto our website, and follow up with anyone who's joined with that link, so you can share that around as well. And as always, if there's anything we can support you, any of us, with your transformation work as you go through them, please do reach out and we'll be happy to help. So with that, thank you and have a good afternoon.
It's been a pleasure. Thanks for having me, Shane. Lovely to see you, Bucky.
Take care. Thank you.
Cheers.
Bye.
Take care.